It is a startling statistic dating back decades. Black women are 3 times more likely to die during childbirth than white women. In recent years, more healthcare professionals have been speaking out about how to improve the outcomes for women.
Queen City News reporter Casey Jones is taking a closer look at what local doctors are doing to address this global problem.
Dr. Portia Cohens, Dr. Kenya Little, and Dr. Monica Washington are OBGYNs at Atrium Health Women's Care North Charlotte. They are all familiar with the recent stories of celebrities like Serena Williams, Allison Felix, and others who have shared their traumatic birth experiences. Their stories shed light on disturbing data showing Black women are 3 times more likely to die in pregnancy compared to white women.
We have to start looking at, what's really going on, and it's the implicit bias and racial disparities that exist between Black women and women of other ethnicities, white women, and why that is there, which is a systemic thing that roots back historical from slavery, Jim Crow, up until now.
New research from UNC Chapel Hill takes a closer look at why Black women prefer Black OBGYNs. Some women interviewed recalled their experience in healthcare, quoted saying, "I didn't have anybody that actually looked like me. I did not feel heard, and I might die with this pregnancy." Dr. Little says systemic racism makes some women more prone to underlying conditions that could complicate pregnancy.
If you think about the ocean and how it pounds against the shore, it erodes away at the land. So the same with the experiences of racism over a lifetime start to erode away at health and well-being of minorities. And I think that then predisposes us to high blood pressure, diabetes, cancers, obesity, depression, asthma.
Data shows the wealthiest, most educated Black women in America have worse health outcomes than the poorest, least educated white women in America.
I myself grew up in a pretty middle to upper class place, and honestly I did not feel any safer than any patient that I've taken care of in terms of my own obstetric journey. I knew that I knew what was going on. I knew that I would be well taken care of, but honestly I was just as scared as any patient walking in.
Fear fueled by facts. J. Marion Sims from Lancaster, South Carolina is considered the father of gynecology. He performed experiments on enslaved women without anesthesia in 1849. His picture hangs on the wall of Dr. Najina Connor's chair of OBGYN at Atrium Health.
We have this burden and we have this responsibility to address inequities, whether, in healthcare, in just social interactions. I think the disparities happen because of the history of racism, the history that this country was founded on, and so it's been woven into the fabric of the country.
Dr. Connor says doctors at Atrium are aware of the global issue and working to address it.
Just knowing that across the country this is an issue, we have to assume it's an issue here as well. We're not immune from the rest of what the country is experiencing, and so just having that at the forefront of what we do, implicit bias training. I do lectures for medical students and residents on health equity.
According to the Association of American Medical Colleges, about 11% of OBGYNs identify as Black, and even fewer are women. Studies have shown a diverse healthcare workforce leads to improved outcomes for patients.
When we go through the selection process to choose residents for our program, we value diversity, and that diversity can be race and ethnicity, it can be just lived experiences, economic diversity, and so we really are intentional about trying to recruit diverse classes.
Atrium Health also launched mobile medical units in Mecklenburg, Union, and Anson counties, giving patients care closer to home. RISE Atrium Community Doula Program connects Black women with doulas as a guide before, during, and after pregnancy. Doctors say they also encourage patients to work with them to create a better outlook than our current reality.
If you feel like the person that is giving you direct care is not listening to you or providing what you need, you can always go up to the charge nurse or another doctor, the chair of the department, those kind of things. And most hospitals, I will say, have a line that you can reach out to for patient advocacy.
Casey Jones, Queen City News.